Sore throat. Introduction. The throat is a tube that connects the mouth to the esophagus and windpipe. The esophagus brings food to the stomach. The windpipe brings air to the lungs. A throat can become sore for many reasons. Treatment of a sore throat depends on the cause. A sore throat can often be treated at home, but sometimes it requires a visit to your healthcare provider. This program explains what a sore throat is and its causes. It also talks about how to care for a sore throat at home and when to seek medical advice. The throat. The throat is a hollow cavity or tube inside the neck. It carries food to your esophagus and air to your windpipe and vocal cords. The throat is also called the pharynx. The tonsils are glands located in the back of the mouth. They are found on either side of the throat. The tonsils are part of the immune system and help fight infections. The uvula is also located in the back of the mouth. It dangles down from the middle of the soft palate. Behind the uvula, there is a passageway that connects the nose to the mouth. Can you point to the tonsils? Choose one of the following. Correct. Sore throat. A sore throat is when the throat is painful, scratchy, or irritated. The pain often gets worse when talking or swallowing. A sore throat may also cause difficulty swallowing, dry throat, hoarse voice or difficulty talking, swollen red tonsils, swollen glands in the neck or jaw, white patches on the tonsils. Often a sore throat happens with other symptoms. These may include body aches, cough, fever or chills, headache, nausea or vomiting, runny nose, sneezing. Often a sore throat happens when the throat or pharynx becomes inflamed. This is called pharyngitis. But sometimes the terms sore throat and pharyngitis can be used to mean the same thing. There are many causes of a sore throat. The next section discusses some common causes. Pharyngitis can mean the same thing as sore throat. Select true or false. Correct. Causes. Most sore throats are caused by viruses. Viruses are germs that cause illness, such as the common cold or the flu. These illnesses can cause a sore throat. Other common viral illnesses that can cause a sore throat are chickenpox, croup, measles, mononucleosis or mono. Sometimes a sore throat may be caused by a bacterial infection, but this is less common. Some bacterial infections that can cause a sore throat are diphtheria, strep throat, whooping cough. A sore throat can also have many other causes. Allergies are one cause. A person could be allergic to pet dander, dust, molds, or pollen. Breathing in these allergens can cause a sore throat. Dry indoor air can also cause a sore throat. Breathing in dry air or breathing through the mouth can make the throat scratchy and sore. The throat may become sore and irritated by air pollution, such as smog or tobacco smoke. You can also irritate your throat by drinking alcohol, chewing tobacco, or eating spicy foods. Sometimes a sore throat is caused by strained muscles. The muscles in the throat may be strained if you yell at a sporting event. They can also be strained by talking loudly for an extended period of time. A sore throat can also be caused by certain medical problems, such as gastroesophageal reflux disease, or GERD, HIV infection, tumors. GERD is when stomach contents reflux into the esophagus. Reflux is the backward flow of liquid. Reflux irritates the esophagus, which is the tube that carries food from the mouth to the stomach. Severe cases of GERD can cause a sore throat when acid goes up the esophagus and reaches the throat. Sometimes a sore throat and other flu-like symptoms can be caused by an HIV infection. HIV stands for Human Immunodeficiency Virus. It kills or damages the body's immune system cells. A person with HIV may also have a sore throat caused by another infection, such as cytomegalovirus or CMV infection, oral thrush. Cancerous tumors of the throat, mouth, or neck can also cause a sore throat, but this cause is less common than other causes of a sore throat. Are most sore throats caused by cancer? Select yes or no. Correct. Most sore throats are caused by viral infections. Home care. Most sore throats are caused by a viral infection. The infection usually lasts around 5 to 10 days and does not need medical treatment. If you have a sore throat, there are many steps you can take to ease the pain at home. This section talks about these home care options. When you have a sore throat, it is important to rest and drink plenty of fluids. Do not talk too much. Drink water and other fluids to keep the throat moist. Warm liquids can help ease a sore throat. Some examples are broth or tea. Cold treats, such as ice pops, can also ease the pain of a sore throat. You can also try gargling salt water. Add 1 teaspoon of table salt to 8 ounces of warm water. Gargle the salt water and then spit it out. For older children and adults, sucking on lozenges may ease a sore throat. Lozenges should not be given to children under 4 years of age. Children this young may choke on lozenges. Keep the air in your home clean and moist. Avoid cigarette smoke and cleaning products that can make a sore throat worse. Use a humidifier to keep the air in your home moist. You can also sit in a steamy bathroom for a while. Over-the-counter pain medicines can be given to treat pain and fever. Ibuprofen, acetaminophen, and aspirin are some examples. Aspirin should not be given to children. What can you do to ease a sore throat at home? Choose one of the following. 1. Drink plenty of fluids. 2. Suck on lozenges. 3. Use a humidifier. 4. All of the above. Correct. When to seek medical advice. It can be hard to know when to see your healthcare provider for a sore throat. Most sore throats will go away on their own, but some, including those caused by bacterial infection, take your child to his or her healthcare provider if it can be hard to know when to see your healthcare provider for a sore throat. Most sore throats will go away on their own, but some, including those caused by bacterial infections, may require medical treatment. Take your child to his or her healthcare provider if he or she has a sore throat that does not go away after drinking fluids. Get immediate medical care if your child has difficulty breathing, excessive drooling, problems swallowing. Adults should see a healthcare provider if they have a sore throat that is severe or lasts longer than 1 week. It is also important to see a healthcare provider if you have frequent sore throats. You should also see a healthcare provider if you have a sore throat with any of the following: a lump in the neck, blood in saliva or mucus, difficulty breathing or swallowing, earache, fever over 101 degrees Fahrenheit, hoarse voice that lasts more than 2 weeks, joint pain, rash. Jill's son, George, is 4 years old and is woken up with a sore throat. He has a fever of 102.5 degrees Fahrenheit. Should Jill take her son to a healthcare provider? Select yes or no. Correct. Jill should take her son to his healthcare provider. Summary. The throat is a cavity or tube that connects the mouth to the esophagus and windpipe. The esophagus brings food to the stomach. The windpipe brings air to the lungs. A sore throat is when the throat is painful, scratchy, or irritated. A throat can become sore for many reasons. Most sore throats are caused by viral infections. Sore throats may also be caused by allergies, bacterial infections, breathing in irritants such as cigarette smoke, certain medical problems such as GERD, dry throat, Strained throat muscles. Treatment of a sore throat depends on the cause. A sore throat can often be treated at home, but sometimes it requires a visit to your healthcare provider.
This video is intended to provide introductory information on this topic to general public health and awareness. You should understand that this health education video includes general information and not specific medical advice. It shows graphics and series of pictures and dialogues that have been simplified for better understanding. If you have any questions, you will check with your doctor or healthcare provider. It is not intended as a substitute for professional medical advice. Always rely only on your doctors in matters related to your health.